Emily Brice from NoHLA, Northwest Health Law Advocates. Thank you, Emily.
Yay!
Also on our policy committee, I hope there's
All right, thank you, John. Hi, everyone. I'm Emily Brice from Northwest Health Law Advocates. My daughter here with me today. For 25 years, my organization has worked every day to make healthcare more affordable, accessible, and equitable for every Washingtonian. 25 years is a really long time, so it's a good moment to pause and ask ourselves, how is our healthcare movement doing? Is our healthcare system working better for people than it was? Okay, well, the good news is that we have made some progress, right? Working alongside all of you, so many friendly faces in this group today, and many others. We've had some important victories in Washington over the years. We've worked together to cover all kids. We paved the way for the Affordable Care Act with our state basic health program, and then we worked with people all across the country to get the Affordable Care Act passed nationally. I saw Gina and family here, shout out there. And then we brought it back home by adopting the Medicaid expansion and building our own state exchange. But we didn't stop there. We pushed to restore many of the worst cuts from the Great Recession. We built on the exchange with the country's first public option, and we were the first state to take swift public health action in the pandemic. And when we realized that our immigrant brothers and sisters were suffering the worst in the pandemic, we showed up in solidarity to demand health equity for immigrants. So I know we can make a difference when we show up for health care. But I have to tell you, we are not where we need to be, not even close. I recently looked back at the 2007 report from Governor Gregoire, yes, Governor Gregoire's Blue Ribbon Commission on Healthcare Cost and Access. And it was a depressing read, I'm going to be honest with you. Nearly 2 decades ago, that Blue Ribbon Commission recommended 16 action steps that would help us reach our healthcare goals. Common sense things, okay? Things like all Washingtonians will have access to health coverage that provides effective care by 2012. 2012, we do it? Okay. Population health will be consistent across race, gender, and income. I want that to happen. Hasn't happened yet, right? And my personal favorite, healthcare spending won't grow faster than personal income. Okay, this is what we said we were going to do in 2007. Let's be honest, we have not met any of these goals, or most of the others in the report either. In fact, the state just cut another 500,000 people off Medicaid. All right, we don't need another Blue Ribbon Commission to tell us we need change. We can just listen to what people are telling us. In a recent survey of Washingtonians, over half went without the medical care and the prescriptions they need because of cost. 1 in 2 rural residents had to deplete savings, sacrifice the basics like food or rent, or go into debt to pay for health care. And the problem is even worse for Black and Hispanic communities, people with disabilities, and others living with structural disparities in our state. But I have hope, because 70% of Washingtons are fed up and fired up. Across party lines, over 70% report that they are ready for change and they support government action to get us there. So let's get to work today and every day. Because when my daughter stands back up here at the podium in another 25 years, I want her to reflect back on the difference that we made together starting today.
Let's hear it one more time for Emily and NoHLA.